HRT is hormone replacement therapy. So it's putting back a little bit of what was there before. And the key to this is that it's using small amounts of hormones. So we use estrogen, we use progesterone, and increasingly now we use testosterone for women. I love talking about the benefits of HRT because nobody ever talks about them, which is a shame because there are so many. So the immediate benefit for women is that you feel so much better. So if you've been waking up every night lying in a pool of sweat like I was, and you start using HRT and then you can sleep, then that's transformative. So symptom relief is really important, but there are other longer term benefits. So for example, one of the most important things that women don't know about is the thing that we are most likely to die from is heart disease. So we're 7 times more likely to die from heart disease than we are from breast cancer. From the age of 40, the risk of death from heart disease is much higher than it is from breast cancer until the day we die. And HRT has been shown to reduce the risk of heart disease by up to 50%. HRT protects your bones. So women die of osteoporosis when they get much older. It's a very common cause of death within the first year of a hip fracture. HRT reduces the risk of bowel cancer by 30%. Did anybody ever tell you that? I'm sure not. I certainly didn't know that. So there are many health benefits. It improves your vagina, it improves your libido. Women who take HRT have a lesser risk of all-cause mortality, so dying from all causes, than women who do not take HRT. So these are very important facts. The risks of HRT actually are extremely small and far outweighed by the benefits. One of the risks is if you take HRT as a tablet, so if you swallow your estrogen as a tablet, there's a very slightly higher risk of having a clot, a blood clot. But it's a very slightly higher risk than not very high at all. So it's still a very, very small risk. The question I get asked a lot about is breast cancer. And there's been so much misinformation over the years about HRT and breast cancer that actually it's scandalous, to be truthful. So HRT will not give you breast cancer. Women have a lifetime 1 in 8 risk of developing breast cancer, but the risk changes with your age. So it's different when you're 40 than it is when you're 70. The risk is increasing all the time. So there's nothing to suggest that HRT gives you breast cancer. But if you have a breast cancer there, it may be that the tumour will grow more, in which case it's detected more easily. And actually what the evidence has shown is that women who develop breast cancer when they're taking HRT have a better prognosis than women who have not taken HRT. So HRT can work very quickly. It can work, certainly from the point of view of hot flushes and sweats, it can work within 3 or 4 days. So it's very variable. We normally say to people, you need to give it 3 months to see whether you're on the right dose or the right preparation. But generally results are quick. For symptoms like anxiety and brain fog and more of the psychological symptoms, it's probably going to take a little bit longer. But generally, I often get emails from women within the first month or so saying, thank you so much, my life is transformed now. There was this figure of staying on HRT for 5 years, which was plucked out of the air really. There's no evidence to support that. So we would normally recommend that women stay on HRT for at least 7 years to give them the benefit for their bones and their brain and their heart. However, you can stay on HRT for as long as you like, and you can stay on it until the day you die. If you feel well and you don't have any other conditions that mean that you can't take it, then there is no reason why you should stop it. And also because we know that many women in their 60s are still having menopausal symptoms, if you tell them to stop taking HRT after 5 years, they're still going to be in the midst of all their menopausal symptoms. So you're not doing them a service at that point. So taking HRT doesn't delay the menopause. Your own hormonal changes will carry on doing their own thing. but it will relieve your symptoms. If you were to stop HRT, your body will be, at that point when you stop it, your body will behave in the way that it would be behaving had you not taken HRT. And again, remembering that many women still have symptoms in their 60s, if you stop it when you're 58, and then women have symptoms, they think that what they've done is just put their menopause on hold and then it's starting again, which is not the case. You go back to where you would be had you not taken it.